The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
Welcome back to AM Northwest. It's the season for spring sports. Here with important information to prepare your kids and keep them healthy throughout the season, we welcome from Providence Family and Sports Medicine, Dr. Thayer White. Hi, doctor. How are you?
I am doing well, thank you.
So after kids have been sedentary for the most part, what's a really good way to kind of ease them into spring sports, you think?
Well, yeah, hopefully your kids haven't been too sedentary over the winter, but we know that happens in Portland. Yeah, I think it kind of depends on the age of your kid. If you've got a young child or an elementary school kid, I think the best approach is just to make sure they're getting outside every day, playing with friends, running around for an hour or so at least. If you've got older kids, middle school, high school, where maybe the sports are a little bit more serious, then you might want to think about, should they be doing a little jogging or conditioning? And that's probably the kind of thing you might want to kind of work with their coach on at that level.
So let's say you have a child going into soccer. Do you think about what nutritionally they should be getting?
Well, yeah, I think it's, I think for all kids, the important thing is to try to keep them eating as healthy as possible. Really trying to watch the sugary junk foods and chips and cookies and that kind of stuff. Lots of fruits and vegetables is always good. And then keeping in mind that kids are gonna, if they're playing sports and they're being more active than normal, they're gonna need some extra snacks during the day. They're gonna be hungry, and so kind of planning for that. And then kind of like I was saying earlier, as kids, when kids get older, if they're getting a little bit more serious in some of these sports, especially at the high school level, there may be some more specific nutritional needs that may be worth talking to a coach or nutritionist or something like that about. They might need a little bit extra calories, extra protein, depending on what they're doing.
And when kids get back into sports, sometimes it's kind of hard to tell if they're suffering from an injury or they're just sore from working out when they haven't been running around like that for a while. Yeah,
and when you're talking to your kids, it's sometimes hard to, sometimes it's hard to get from them exactly what's going on if they're anything like my kids. But I think there's a couple general things that parents can be watching out for. The usual soreness from a new activity should get better after a week or two, and it's usually pretty spread out. Like all the legs is sore. But if it's one specific area that they keep saying, if your kid keeps saying, "Oh, my right knee hurts," and it's always the right knee, that's probably something worth getting checked out. And then the other thing I like to mention to parents is if you ever see a swollen joint or a swollen muscle on your kid, that's never normal for a kid, and that's always something you want to get checked out.
And lastly, paying more attention now to a kid's heart health. So what should parents check when it comes to making sure that they've got heart-healthy kids?
Yeah, well, I think the most important thing is making sure you're getting your kids in for their regular checkups, because as part of that, they're going to be getting their blood pressure checked, and their doctor's going to be listening to their heart and making sure that everything sounds normal and is working normally there. And then, kids who do high school sports, there's required health evaluations that they have to do before they can play. One of the things to make sure to let your child's doctor know about is if there's any family history of heart disease. That's always one of the things we really want to pay attention to. And if that's the case with certain heart conditions, then there may be a little bit more close attention that needs to be played on that.
Absolutely. I want to tell everyone, if you'd like to find out more, you can contact Providence Medical Group. The number is there on your screen, and we'll put all that information on our website at KATU.com. Dr. White, thank you very much.
Oh, thank you very much. It was nice to be here.